Hyperkalemia in patients with EKG changes requires urgent treatment with glucose, insulin, beta agonists, and possibly calcium chloride. Severe hyperkalemia can cause life-threatening arrhythmias, and these treatments help stabilize the heart and lower potassium levels. Always check blood glucose in patients with altered mental status to rule out hypoglycemia as a reversible cause. Hypoglycemia is a common, easily treatable cause of altered consciousness that must be addressed immediately to prevent brain injury. Acute urinary retention does not require gradual emptying of the bladder. Prompt relief is essential. Rapid bladder decompression is safe and necessary to prevent further discomfort and complications such as renal damage. Dialysis is indicated for severe hyperkalemia, certain poisonings, and life-threatening metabolic imbalances. In situations where medical management fails, dialysis can quickly correct dangerous electrolyte imbalances and remove toxins from the blood. Testicular torsion must be suspected in any male patient presenting with sudden onset lower abdominal or scrotal pain, as it requires prompt surgical intervention. Delayed treatment of testicular torsion can result in permanent loss of the affected testicle due to compromised blood flow. Recognize electrolyte disturbances such as hyperkalemia in trauma patients and manage them promptly. Electrolyte imbalances in trauma patients can exacerbate injuries and lead to cardiac or muscular complications if not corrected quickly. Acute renal failure in trauma patients can result from rhabdomyolysis, requiring aggressive hydration and possible dialysis. Rhabdomyolysis releases muscle breakdown products that can damage the kidneys, and aggressive hydration helps prevent renal failure. Immobilize open fractures early to prevent further contamination and soft tissue injury. Immediate immobilization of open fractures helps reduce the risk of infection and prevents further damage to surrounding tissues. Consider compartment syndrome in patients with crush injuries and monitor closely for rising compartment pressures. Compartment syndrome can lead to tissue necrosis and requires urgent fasciotomy to relieve pressure and restore circulation. Immobilize all patients with potential cervical spine injury until imaging confirms no fracture. Failure to immobilize the cervical spine can result in permanent spinal cord injury, so precautions are essential until cleared by imaging. Lateral C-spine X-rays must visualize all 7 cervical vertebrae to rule out cervical spine fractures in trauma patients. Missing visualization of the lower cervical vertebrae can lead to undiagnosed fractures, risking further spinal injury. Pelvic fractures can cause life-threatening hemorrhage, requiring immediate stabilization and resuscitation. Pelvic fractures can damage major blood vessels, leading to severe internal bleeding that requires rapid intervention to prevent shock. Gunshot wounds to the extremities may require vascular imaging to assess for vascular injuries. Vascular injuries and gunshot wounds may not be immediately apparent, so imaging is crucial to detect and repair these injuries. In trauma cases, splint fractures in the position of deformity if there is vascular compromise. Fractures with vascular compromise should be splinted as found to prevent further damage to blood vessels and ensure blood flow is maintained. Blunt or penetrating trauma to the chest should raise suspicion for rib fractures, pneumothorax, or cardiac injury. Chest trauma can result in life-threatening conditions such as airway injury, pneumothorax, hemothorax, cardiac tamponade, and aortic disruption. Open fractures should be stabilized and evaluated for soft tissue damage before definitive treatment. Stabilization reduces further damage. An early evaluation of soft tissue injury helps guide surgical repair and prevent complications.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.